So like think about, a couple hundred years ago, 20+% of babies were not living to the age of 5, all right? That's 20 of every 100, that's 2 out of every 10. That's a lot of kids. Vaccines is one of the reasons that now most babies where vaccines are available live throughout childhood, and there's less worry that is my baby even going to survive. So we give those vaccines to the younger babies because that's the highest risk time of getting infected and complicated disease from the different infections.
Hi, everyone. Welcome back to The Unplanned Parent. The Unplanned Parent is hosted by a medical doctor, me, and we have another doctor today who's a guest. But as a reminder, even though we are doctors talking about medical things, we want to remind you this show is not providing medical advice. Your medical advice always comes from your treating physician or personal medical team. Now that we've gotten that out of the way, let's dive into our show. I'm Dr. Angel, here hosting with my head-banging, guitar-jamming, festival-going brother, who's a dad-to-be. The baby's just around the corner. Today, we're joined again by Dr. Samantha Johnston, pediatric infectious disease specialist at Stanford, and one of my favorite people from our UCLA days, and just one of my favorite people in general. Last time Samantha was here, we talked about vaccines during pregnancy. Today, we're picking up where that left off because now there's an actual baby on the way, my brother's baby. It's just around the corner, and that baby is going to need a lot of shots. For those of you who didn't get to hear Samantha's credentials, I'll mention them briefly because they're very impressive. Dr. Johnston studied biology at Stanford. Then she went to medical school at Columbia. She did her residency in pediatrics and fellowship in pediatric infectious diseases at UCLA. And she somehow, during all that, managed to get a master's in public health from Johns Hopkins. UCLA is where Samantha and I met, and we're so glad to have you back, Samantha. Thanks for joining us.
Thanks for having me. It's fun to see you guys again.
We just have to talk a little bit about the way that we used to hang out versus the way we hang out now. I seem to remember our motto was like, go big or go home.
Yes. Our motto was go big or go home, and I still use it.
It's not like stay mediocre, go home early, or don't even leave the home, maybe?
No, it just applies to like soccer games. Going out.
That's so funny. I never say go big or go home now. I'm like, go medium and then go to bed.
Yeah.
But yeah, I could see if I had sporty kids, maybe I would be saying go big or go home. I should say that at like the next mock trial.
Yeah, when we were like when we were clubbing in Vegas, were we talking about childhood children and vaccines, or what were we talking about?
And actually during like our time in the call rooms together, I mean, Samantha and I spent a lot of time together in this shared trauma kind of environment, going through residency together, and we didn't really talk a ton about vaccines then either. I think at least you must have, because you did an infectious disease fellowship, but during my residency training, I remember so much being focused on like what was really scary, like keeping a child alive during their really sick times in the hospital. I don't remember so much of a focus on like preventive health. Like we knew vaccines were important, but I didn't know until I was out in practice and I saw the difference between the kids that that I was vaccinating and we were preventing their hospitalizations. And I could see that difference between those kids and the kids that we had been seeing during our training that were in the hospital because those vaccines weren't necessarily there at the time. I think we trained during the cliff,
there's a few vaccines that have come out sort of in the years that we were training. So we would still see a lot of pneumococcal disease, like disease caused by Streptococcus pneumoniae that's now vaccine preventable for the most part.
And same with Haemophilus influenza. And I mean, it was really a steep drop off because when I was in medical school and the same time you were in medical school, I don't know if it was the same for you, but we were admitting babies nightly, many of them doing spinal taps on every baby that had a fever, looking for diseases like Haemophilus influenza and strep pneumonia, both of which are vaccine preventable now. And then we didn't do that during residency, just a few years later.
Yeah. I mean, I think like the Haemophilus vaccine came out in the 80s. So I think people who trained during that time really had a big steep drop off of babies coming in with concern for like meningitis in the middle of the night. And then when we were training, it was like the streptococcus, the pneumococcal disease, like the Prevnar vaccine had come out, and we were sort of in that bridge time.
Yeah, that it makes sense that just in our own anecdotal timelines that Prevnar came out around 2000, because that's when we were in medical school, and then the drop off in the number of kids with meningitis we were able to see with our own eyes so quickly. It was like magic.
Yeah.
So yeah, I feel like we used to see so many more cases of meningitis or kids that were living with the complications of meningitis. So maybe that's what I'm remembering when I think about Haemophilus influenza or Hib meningitis, because I would see these 10, 15, 20-year-old kids in kind of vegetative states that had been typically developing kids until they got meningitis. And we were seeing so much less of that.
Yeah, I mean, prior to the introduction of the Haemophilus influenza B vaccine in the 80s, there were something like 20,000 cases of invasive, what we call Hib disease, every year. And after introduction of that number, the lowest point that it was recorded, it was 36 cases in a year. So, introducing that vaccine decreased invasive Hib disease by 99%, which is really pretty amazing. Over about a 10-year period.
Yeah, I actually think those 36 cases were reported over a 10-year period. So there were...
Oh, right. Oh my gosh. Yeah, from 2009 to 2018, there was only 36 cases total over those 10 years. What the heck? Yeah. It's a miracle.
Yeah, it's kind of great, but now we have a bunch of pediatricians who don't know how to do spinal taps anymore, which is great if we don't need to ever do them on babies.
Yeah, but I think that it also presents the question of like figuring out when should you not do it is a little harder. For us, it was a little more straightforward. Like, okay, your baby is under a month old and they have a fever. This is what's happening. Even if your baby's under 3 months old.
Are there downsides to spinal tapping a baby? I mean, there's a heavy metal band called Spinal Tap.
It sounds super scary.
Yeah, and sometimes you don't get it on the first poke, and the babies get poked multiple times to get...
Yeah.
I mean, for anyone who's gotten an epidural, all those moms out there, you're in so much pain, I think, when you're in labor that you're like, just give me the epidural. But it hurts. There's someone sticking a needle in your back.
Are you going in between the vertebrae?
Yeah, so you find the little spot like at the bottom of the spine, and you go in between vertebrae, and the bottom of the spinal cord is no longer like solid nerve tissue. It kind of is like, strands.
Like tentacle strands that kind of come
so
down.
when the needle is introduced, you aren't, going into the spinal cord and causing damage. Those things move out of the way. But there is you have to use sterile technique because you don't want to introduce infection. There's sometimes, like Angel was saying, it's hard to get the exact right position because we're talking about like little tiny babies, and sometimes there'll be like a little bit of bleeding at the site, and there'll be a little, that kind of thing. But people always ask about like, oh my gosh, this is going to paralyze the baby, and that's not really a thing.
Stick with us, and we'll make sure you know why your baby is getting more bang for the buck out of today's vaccines, and why your baby's immune system is not actually overwhelmed when they get shots at the pediatrician's office. Okay, so let's just jump into some common questions around early childhood vaccines. I practiced as a general pediatrician for a decade and a half, and I was giving them all the time. And so I would get questions from parents all the time. But Raman, what questions do you have like right now, like about your baby coming?
I kind of wanted to just start off a little bit more broadly. Samantha, as you know, it's been deemed my turn by the powers that be to pass on these most fabulous genes. And, there are anxieties that surround basically every aspect of this, but I don't think one of them should be vaccinations. So, maybe a brief overview of childhood vaccines, what they are, maybe help clear up the air and maybe any misunderstandings that may surround them.
Sure. That's a brief topic.
You have 1 sentence of time.
Okay. So yeah, I mean, currently in the United States, we recommend that babies be immunized routinely against 17 different infectious agents. So these are viruses such as measles. These are bacteria such as Streptococcus pneumonia. That's a common cause of bacterial pneumonia. And we do that because prior to the vaccine era, and even now in parts of the world that are developing, vaccine preventable diseases account for 40% of the deaths, 40% of deaths in kids under 5 years old. So like think about, a couple hundred years ago, 20+% of babies were not living to the age of 5. All right. That's 20 of every 100. That's 2 out of every 10. That's a lot of kids. Vaccines is one of the reasons that now most babies where vaccines are available live throughout childhood. And there's less worry that is my baby even going to survive? So we give those vaccines to the younger babies because that's the highest risk time of getting infected and complicated disease from the different infections.
So just to be totally clear, in that early infancy period, those first months up until the first few years of life,
yes,
that's when the immune system is most susceptible to these sometimes very devastating diseases.
Exactly.
So one of the listener questions that popped up a few times was surrounding Hep B and giving it at childbirth versus delaying it for a few months. And one of the arguments that seemed to be recurring was that a lot of first world nations, I believe Canada and some countries in Europe, it's their standard practice to do it delayed after 2 months after birth. And it seems to also be trending in California and the United States as well that a lot of people want to delay. Are there any pros, cons to delaying? Why is this even a topic? Why do some countries treat it differently? Also, you have one sentence.
Oh, great. Perfect. That's the easy one.
to respond.
Okay. No.
And please answer in the form of a question.
Yes.
Okay. Yes. No, hepatitis B is a hot topic right now. And so hepatitis B, just a little background, it's a virus that causes hepatitis, so like inflammation of the liver. And in a certain percentage of people, it can go on to cause chronic liver infection. And in adults, that's lower than it is in kids. So if you're an adult and you get hepatitis B through, let's say, blood transfusion, sharing needles, sex, different ways of getting Hep B, you have about a 10% risk of developing chronic hepatitis from that. And then you'll also have a risk of getting liver cancer and dying early because of that. Now, if you're a baby and you're infected in childhood or even, at birth or up to a year, you have more like a 90% chance of developing chronic hepatitis and a 25% chance of developing liver cancer and a short life because of that. So a lot of transmission has happened from mom to baby during the birth process. Not all. Some of it can happen, through different household contacts who might be shedding hepatitis B virus, daycares, who knows where, because there is a percent of kids who get exposed to hepatitis B out in the world, not just from mom. So in our country, in the 1980s, when the hepatitis B vaccine became available, we started screening moms to say, okay, do you have Hep B? If you do, then we're going to give you the vaccine. And that worked to some degree, or give the baby the birth dose of the vaccine and the first 24 hours of birth. And that worked to some degree, but there was still quite a lot of transmission of hepatitis B infection in children and babies, like thousands of cases per year. So then in 1991, the ACIP, the committee that advises on immunization practices in our country, said, you know what, we're going to do a recommendation for universal birth dose of hepatitis B vaccine. So, and why do we do that? Sometimes the screening in moms, I think it's like 60 or 80% get screened for Hep B, but not everybody. People fall through the cracks. Some people don't get prenatal care for whatever reason. Some people, it just falls through the cracks. So then you're getting transmissions of hepatitis B because of that. So we said, you know what, we're going to recommend it to be universally given at birth. And that has actually dramatically decreased the number of infections of hepatitis B from like 20,000 per year, not 2,000, not 200, 20,000 per year to, I think it was something like 36 or something, the lowest. I might be misgiving that number, but really a precipitous 90+% decline. in transmission of hepatitis B. So that's why we give that birth dose.
So if you are a mom who is up to speed on what you're doing and you have been screened for Hep B and you know you're negative and you're vaccinated and your risk is quite lower than, perhaps someone who just wasn't on top of it, it's still recommended at birth, right?
It is, because babies are not only exposed from mom. Babies can get exposed to other people who might be shedding the virus. It's not only a blood, it's sort of classically thought of as a blood, what's the word, like blood-borne infection, blood to blood, sharing needles, blood transfusion, birth, that kind of thing. But it's also, there is a degree of transmission that is not just blood-borne, which accounts for some of the exposure that babies will get in that first year.
Am I remembering correctly that there was even a case that they think was salivary transmission from daycare, or there were daycare transmissions? So I guess there's technically you could get cuts in daycare too, and so it could be blood. It might be hard to differentiate.
Yeah, it's not exclusively bloodborne.
To maybe know this answer, but I mean, I'm assuming there is a reason why other developed countries do the 2-month delay.
They might have they might tolerate higher, they might be okay with the amount of hepatitis B transmission that they're having. I mean, every government, every person has their risk benefit cost effectiveness calculation. And just
they might also have universal health care, so they can screen every mom and we don't. So I think
we're not all the same country. Yeah. And they might have a lower, I don't know what the prevalence of hepatitis B is in Canada. If it's really low, then it's less of an issue that somebody's going to be exposed to it.
Just to nip this in the butt, there's probably no upside in delaying.
In the butt. Usually we nip it in the butt.
Is it the butt or the bud? Nip it in the bud. Oh, I've nipped it in the butt my whole life.
Well,
can we scratch that from that's embarrassing.
No.
It's not. But I think we should keep saying that.
You need to know so you can teach your baby the right aphorism.
I kind of like butt. I'm a little disappointed. So to nip this in the bud and the butt, is there any upside to delaying?
Parental anxiety, maybe.
Yeah, a lot of moms, who are really hesitant. I used to just say, this is one I'm not going to argue about. I won't put up too much of a fight, because come down the road, I'm going to put up a stronger fight against, in favor of the vaccines that prevent meningitis. Nevertheless, I think the data support that doing it at birth is way better, because the parents who choose to delay that birth vaccine are less likely to complete the vaccine series. So you really should, I should put up a stronger fight with Hep B, but even pediatricians get tired of having this discussion over and over again. And I think some parents want to have some control in the situation. And so I kind of get that, but I also think, kind of alluding to what you said earlier, Raman, there's so many things to be anxious about when you're a parent. And I will tell parents that a lot, you chose me to help guide you for your early childhood years. So if you chose me, that should mean you trust the medical guidance I'm giving you based on all the research out there. And I'm putting that together for you and telling you that I agree with all of these recommendations that are out there by these organizations. So we're going to do this for your kid. But if you want to make those decisions for yourself, then that's just putting so much stress on someone who doesn't have medical training. And humans are so susceptible to anecdotes. And well, this happened when my kid had we are really bad at kind of separating the wheat from the chaff. And so you have to rely on experts that hopefully are doing their job.
People tend to trust their pediatrician, their family provider when it comes to all these things. So if you have questions, ask them. They're trusted providers. They're a trusted voice for a reason. And when people have that personal relationship, they tend to trust their doctor, their child's doctor, with those things. And you can build up a rapport over time. And I think it's actually incredibly important for providers and doctors to recommend these things and talk, engage your families in these conversations.
Exactly. So I think what you're saying also is that if you are a physician that's listening to this, your patients want you to tell them what to do, and they are more likely to get vaccinated if you tell them to get the vaccines on schedule, on time. The onus is upon doctors to stay on top of the recommendations, the guidelines, look into why they're changing. We've had them change before. There was a rotavirus vaccine that was pulled aftermarket, and there are reasons why, but I think specific to hepatitis B, Samantha, do you want to talk a little bit about the problems with ACIP's decision to pull hepatitis B from that birth dose? And
well, so that's a kind of a broad issue. In the last year or so, starting last June, the standing 17 members of ACIP were fired, and a new panel was appointed.
And what's the ACIP?
ACIP is an advisory committee on immunization practices, and they are typically experts in vaccine science, public health, et cetera, who advise the CDC and what are going to be the vaccine recommendations for our country. And so last June, 17 of those members were fired and replaced with 12 new appointees who didn't have the same expertise in vaccines and public health. And the process that has been leading to the changes in recommendation has been really altered from what it used to be, really, really deeply based in evidence and studies, which hasn't been happening. So a number of recommendations were made in the last year by the new ACIP panel to include, I think, 7 different of the routinely recommended vaccines were changed to shared clinical decision-making, which would mean they would be a discussion between the doctor and the patient rather than just routinely recommended, which I can comment on that also. But the Hep B birth dose was one of those. However, there has been a lawsuit from the AAP, the American Academy of Pediatrics, and others have sued the Health and Human Service, HHS, Health and Human Services, about these changes and about these recommendations. So as it stands right now, these changes have been stayed and the new appointments have been stayed. So the current official CDC recommendations for vaccines are as they were prior to June 2025. So currently, hepatitis B birth dose is recommended by the CDC, by the AAP, the American Academy of Pediatrics, by the American Academy of Family Practitioners, by everybody. That birth dose is recommended. And the reason is because people fall through the cracks, and we still see hepatitis B in babies if it's not. And we know that from experience.
Angel, as a pediatrician, are you kind of required to follow what the AAP says, or are you allowed to have your own opinion?
You can do what you want as a licensed board. I mean, you don't even have to be board certified, honestly, as a physician, unless someone complains about it. I mean, when Samantha and I were training at UCLA, there was a well-known doctor who didn't believe that HIV was the virus that caused AIDS. He had a following of patients, and he would have babies that were born with HIV because he wouldn't prophylax the moms. And we would have babies that had these infections that they had, like AIDS-related illnesses that, obviously, like the kid would develop AIDS at some, I mean, I guess that's not obvious anymore.
I would think these would be grounds to get disbarred.
Well, it's not a bar, unlicensed.
Well, whatever. You know what I mean?
Yeah. Yes. And some people complain and some people don't. Like, this parent was on board. This parent also believed that, at the time, am I remembering that story correctly?
I remember there's a little girl who had like an ear. She was born with HIV and had AIDS, and she had like she's having some recurrent ear infections or something. And I think that then she went on to have like meningitis or something horrible because of the AIDS part, and it was the whole thing. Yeah.
Yeah. And I think we're remembering 2 different patients because there were multiple patients. Because I remember a kid who had PCP pneumonia and who ended up having the PCP pneumonia, which you don't get unless you have AIDS, really. And that this was also a child that was.
Okay.
Anyway, we're really getting into the weeds now.
Yeah. Doctors don't have to follow the rules because these are not rules. These are guidelines.
Well, they're recommendations. They're guidelines and recommendations. Yeah.
Yeah, so it is then that, so doctors are supposed to do the right thing. They're supposed to stay on top of the medical literature. And that's why I do think that some patients probably feel like, well, maybe I can do my research. Like maybe these doctors aren't as good as me in doing the research. So I guess I can see that a little bit, but I think maybe the research should be finding the right doctor who's
Yeah.
had the right training, who understands like the foundational questions to ask because and know how to keep up with medicine because they have a foundation that you trust and develop that relationship. So finding the right doctor might be, I think, more important than deciding which vaccines are right for you and your kid.
Yeah, I mean, I don't think people realize how much deep knowledge the people who study vaccines have. Like it's really I don't know what the right word is to like make it land. Like people just know so much. They have spent their entire lives understanding this and dedicated to the health of children.
Great. So what if a baby is tiny, premature, jaundiced, sick, just not a, I don't want to say normal, healthy baby, but has something going on? Does that change the scheduling of the vaccines?
A little bit. So with the premature baby, like, some babies are born 2, 3 months really early. They generally will the Hep B vaccine will get postponed until they're a certain weight, and they'll usually start their immunizations once they're kind of out of the period of needing support, generally in the neonatal intensive care units. So they'll start their vaccines kind of as they're getting healthier and a little bit more robust. And the routinely recommended vaccines are generally start at 2 months of age. So the only one that we give as a birth dose is hepatitis B. The other ones they start at 2 months. They can be given as early as 6 weeks, but they start at 2 months and then go on from there.
Is that why people generally don't expose their baby when they're brand new?
Yeah, that's part of it. Yeah. So that usually, people are kind of keeping their baby at home, keeping them away from anybody who's sick, partly because they're not protected from vaccines. I mean, the babies will have some protection from the antibody that mom will pass to them. Um, but the premature babies don't have the benefit of that because they're born kind of before that process happens. But also, if a baby is born, gets a fever before they're a month old, if you take your baby to the emergency department, the doctor's gonna want to do a blood sample, do a catheter to get it in a urinary catheter, which doesn't feel good, to get a urine sample, and they're gonna want to do a spinal tap to make sure that baby doesn't have meningitis. So that's why people kind of keep their babies away from people who could be sick because nobody wants their baby to go through that.
So Angel, when your kids come to visit, you better check their temperature, huh?
I know. Well, I mean, that's the hard thing because even if everyone at home is sick and you're like, I'm sure my baby has the same cold that that I have or that my friends' kids have or my other kids have, it doesn't matter because those little babies are so susceptible to secondary infections. Like even if the child has like tests positive for RSV and is kind of like okay drinking enough, you still have to check their urine because there's like kids that have RSV that increases the risk of getting a urinary tract infection. It's kind of like their immune systems are
They're just not online yet.
yeah, they're not online. They're still in that fourth trimester. And so
Yeah.
they have to really be cocooned.
Yeah.
I do think it's kind of interesting, like, well, if we can prevent things like hepatitis B from being transmitted and we give it at birth, why don't we give other vaccines earlier? Like we wait to give measles until age 1. Maybe our listeners want to know a little bit more about the timing of vaccines, Dr. Johnston.
Sure, I can talk about that. So in the first, there is sort of a balance between when those vaccines are going to work well, because as you mentioned, Angel, the baby's immune systems are just developing, and I think if you give them too early, they don't have as good of an effect. So that's why we wait until the 2 months. Also, yeah, so some of those antibodies that mom gave the baby are going to protect them to a degree in the beginning, not 100%. And so the things that we give in that time are like tetanus, diphtheria, pertussis. The reason we give pertussis early is because basically the people who die of pertussis are babies under 6, really under 4 months old. So we talked in another time about pregnancy doses of pertussis vaccine, but giving the baby that first DTaP or pertussis containing vaccine really helps them in preventing serious complications. So if you get that in at 2 months old, then your baby's already has an advantage there. We also give polio, hepatitis B, Haemophilus influenza. So we give all those in the very beginning.
Yeah, and the 2 meningitis ones.
And the 2
Let's not
meningitis
forget
ones. Yeah.
the meningitis vaccines.
The Haemophilus influenza type B, and then Streptococcus pneumoniae.
Which multiple strains of.
There are many strains of that one. That one came out initially as a fighting 7 strains of that vaccine. The one that we give now does 20 or 21, depending on the vaccine that you get.
So I don't think either of you guys want me calling you very frequently. So it might be good for everyone to know what are the most common side effects of vaccines that shouldn't cause a freak out, maybe?
That's a good question. Yeah.
Well, let me take this one because I was seeing this in the office all the time. And so it was like anytime I would give the vaccines, I'd be like, okay, so, your baby could develop a fever. The babies can have crying. They can have really intense crying, more than they typically have.
So can we backtrack to fever? Because fever could also mean you go to the hospital, the kid might have meningitis. So how do we decipher what's going on and what to worry about, if it's possible?
And sometimes you do call your pediatrician if your baby has a fever after vaccines, especially if it's, different offices might tell you the different cutoff for when they want you to call. But certainly if your baby's having a high fever over 102, probably your pediatrician's wants to see the baby. But most pediatricians, I think, would say in that first 24 hours and maybe even 48 hours, if your baby's feeding well and peeing and pooping and has decent energy and has a fever, it's probably vaccine related. Now, that's not always the case, so you should have that discussion with your pediatrician. But it is really common to have pain, irritability, soreness at the site, maybe even a muscle, feels like a knot at the site. All of those things are normal vaccine reactions. And, I think parents get really scared. I remember for my kids' my oldest, the first set of vaccines, I don't think I was ever in the room. I would walk away. My husband would have to hold the baby so that I wouldn't have to see her get her vaccines. And it was just stressful for me. So I'm sure it was a little stressful for her too.
I was there and I remember just breaking out in a sweat, just oh God, here I go.
What, during the vaccination process?
Yeah, because we know that
the needle's this big and the baby's this big.
No, but it does hurt when it goes in, and I think that's stressful because you're doing the right thing, but it does hurt your baby, and you don't want to experience that. And I understand that.
Yeah, and I will be 100% honest, and I've told my patients this. I got nervous when I was giving my kids their vaccines. Every one of them, that first set of vaccines, it did go through my head. What if this will give my kids autism? What if it triggers their immune system in a way I don't want their immune system to get triggered? All these things went through my head, but I knew I had to talk my rational self into.
What if the wrong medication's in the needle?
Well, that's probably a bigger concern. Yeah.
Yeah, the media gets to even the most informed people. So I had to talk myself down off the ledge and, remind myself that I've heard the same stories, but I also know that this is the right thing to do. And this is what is going to be best for my kid and my community, honestly, to vaccinate on schedule. So all 3 of my kids were vaccinated on schedule. I don't know if Samantha, if I want to put you on
too.
the spot.
I do want to just touch on that. So you mentioned a couple of things there, Angel, the thing that went through your mind. And I think the autism question has been something that's been that's out in the sort of zeitgeist as a concern. So let me just address that because it's a big deal. And I don't want people to think that that is a possibility because it's really not. And it's been studied up, down, left, right, inside out. Could autism be associated with vaccines? There's been a lot of, I don't know how many hundreds of studies have looked into this question. So the history of it is in the late 90s, Dr. Andrew Wakefield in England did a study. It had to do with gastrointestinal gut health and on less than 10 patients, and somehow came to the conclusion that possibly the measles, mumps, rubella vaccine might be associated with causing autism. Now, he didn't really have any data to back this up. And it turned out that some of the data that he had presented wasn't necessarily fully factual. He had been taking money from some legal counsel or something. And at the end of the day, that paper got retracted and he lost his medical license due to this faulty study. But that kind of thought had been put out there. And unfortunately, people then got concerned about autism in their children following measles, mumps, rubella vaccine, and it led to decreases in people vaccinating their babies, particularly in England where this happened, and really big outbreaks of measles happening with associated mortality and a lot of kids ending up in the hospital. And since then, the question, people have studied it. Well, I don't know, could measles, mumps, rubella vaccine be causing autism? And as there's a temporal relationship, kids develop autism. Some kids develop autism, and often that diagnosis is made around 1.5 to 2 years of life. When do we give measles, mumps, rubella vaccine? Typically 12 to 15 months. So people say, oh, could this be, actually triggering that? There have been a lot of studies that have been done that look at the sort of the rates of autism that have been changing over time. Are they associated with vaccines? And we find that the definition of what we call autism has changed over time and has become more broad. But if you look at the sort of the prior definition of autism, the background rates haven't changed since we introduced vaccines decades and decades and decades ago. There's a lot of data that supports the notion that vaccines are not involved in causing autism, and we should probably be looking at other causes and spending our effort looking at what actually does cause autism, which probably has to do with genetics and maybe some other environmental triggers. But I just wanted to address that point.
No, I'm so glad you did. And I think another something that I will often tell patients too is that they've actually looked at populations of kids that were vaccinated on schedule and kids that were not vaccinated. And the rates of autism are the same in the two groups, which is, I think there's no better data than that to say that. So yes, there are going to be some kids that get vaccinated and end up getting a diagnosis of autism. And there are also going to be kids who are not vaccinated and end up getting a diagnosis of autism, because autism is going to happen in both groups, whether or not you get vaccinated. And so but I can also understand when you have a diagnosis that there's not really like a great treatment. I mean, there are a lot of interventions for autism, but parents want something to kind of latch onto.
Yeah, it's a cause of anxiety. Yeah. And I wanted to go back to the question you had about measles timing.
Yeah.
So we give the measles, mumps, rubella vaccine when kids are like a year to 15 months, typically, because they have gotten the antibody from mom, and that does protect to a certain degree in the first 6 months of life. First, year of life against developing measles. And that maternal antibody is thought to interfere with the response to the measles, mumps, rubella vaccine, such that immunity doesn't develop as fully. It might be more nuanced than that, and there's more studies going on. But where we've sort of landed in where you have kids getting some protection from maternal antibody and that antibody not interfering with the vaccine is giving the dose at 12 to 15 months in the States. Some other countries give it earlier.
Yeah, I think if the risk of measles is higher in your country, you might just get the vaccine earlier.
Yeah, some countries give it at 6 or 9 months.
Yeah, so even in the US, if you are going to be exposed in a high-risk measles environment, so when families are traveling to areas where there's more measles, we will give it between 6 and 12 months. It just doesn't count as your first measles vaccine. So you still have to get one after the child is 12 months old. And so I just have to be clear with the parents about that but most parents are very willing to do that and want to protect their kid from getting measles at a young age, because again, measles at a very young age does have a high complication rate, high mortality rate, and even you can get measles, like all of these diseases, they can go to the brain. So
yeah, and the younger you get measles, you can get this horrible thing years later, an encephalitis that's universally fatal due to measles, which is horrible.
And that can show up like 10 years after measles, right?
Mm-hmm. It can show up 10 years after the fact. Yeah.
And so this is another thing that I'll tell parents who are hesitant to get the measles vaccine. I say, vaccines have been studied for a long time. And Samantha, you probably know when the first vaccines were, started to be given, but at least for the last 50 to 70 years in the US, we've been routinely giving vaccines. And we know that vaccine reactions almost universally happen within the first 6 weeks of giving the vaccine. But something like this measles encephalitis that can happen like 10 years later, you don't get that from the vaccine, but you get it from the actual measles infection. So those are the types of long-term complications that I would be concerned about as a parent, which is why I did vaccinate on time.
We were talking about side effects also.
Yeah.
Side effects and primarily like what should a parent be worried about, which side effects and which ones to kind of not worry about?
I mean, the things that are common, right, Angel, are like fever, it hurts. I mean, whenever you've gotten your last tetanus shot, it feels like you've been punched in the arm for a couple of days. And sometimes you get a little hot.
Sleeping more.
Yeah.
Yeah, you could get hot sleeping more than usual. So that's also common for babies.
So yeah, that's common for babies just like it is for anybody else. So those kinds of things aren't really much to worry about. Every vaccine there's a very low, like less than 1 in a million chance that you might have an anaphylaxis, like a severe allergic reaction. They're very uncommon, but they do happen. And if that were to be your child, that would be something to talk to your pediatrician about. Maybe see an allergist who could say, because now we have these combination vaccines. So which one was it? You can get 6 in 1. So, which component was it?
Samantha, is that allergic response to the active ingredient in the vaccine, or is it, like one of those other ingredients like that people kind of freak out about, like aluminum or formaldehyde or?
Yeah, it could be to any of them. And so it's hard to know. So it's probably best to get evaluated by an allergist, and they can try to work out, okay, which component do we think it was? Should you get vaccinated again? Because if you have like a legitimate anaphylactic reaction, because those are life-threatening, you probably shouldn't do that. Like I said, it's extremely rare, but it's worth talking to the specialist to try to figure out which component it was so you can get the other ones.
Oh, we've got to talk about 2 things here: egg allergy and the aluminum thing you mentioned, Raman. So first of all, I just want to say, because the flu vaccine there used to be a concern that if you had egg allergy, you couldn't get flu vaccine. That then people said, well, maybe you can get the flu vaccine at the allergist's office. And now this has been studied so much. So let's be clear. You can have that discussion with your doctor if you're egg allergic, but general guidelines are that you don't have to be treated differently if you have an egg allergy and you want to get the flu shot. You're essentially treated like everyone else now.
Right.
So yeah, just speak to aluminum really quick, because parents get really nervous about aluminum, but it is in vaccines because it helps the baby's immune system have the response that we want to see. It helps stimulate the immune response in a baby.
So aluminum is present in vaccines, and like you said, Angel, it helps babies respond properly to vaccines so that they work. Aluminum is in our environment, and it's in the Earth's crust. It's in the food that we eat. And that includes in breast milk and in formula. So the estimates are that if the baby gets their vaccines on schedule, in the first 6 months, they will receive 4.4 milligrams of aluminum through the vaccines. And that is less than the 7 milligrams they will get from being breastfed in the first 6 months of life. The something like 38 milligrams that they would get if they're formula fed, and over 100 milligrams that they will get in the first 6 months of life if they're receiving soy formula. So just keep that in perspective. The aluminum they're getting from vaccines is a fraction of what they're getting from their diet. Now, there are a few people, this happens rarely, that will get a local reaction at the site of the vaccine that looks like it's like a little fluid collection. It's what we call a sterile abscess. So it's like a reaction to the body where they get kind of a little cysty thing. That's not an allergy, and it goes away over time. It's very rare. And again, if your baby is one of the people who gets that would be worth a conversation with your doctor about.
Yeah, more likely they're going to just get some redness and swelling at the site, which is very typical also after vaccines.
And not a reason to call the doctor.
Not necessarily, but you know what? If you're worried, call the doctor. It's fine. That's why they're there. Yeah. And that also reminds me of the Arthus reaction.
Tell us about the Arthur's reaction.
So some people, it happens particularly after repeated tetanus and diphtheria, so like Tdap and DTaP vaccines. Some people will get a really intense red blotch in their wherever they get that vaccine, and it's hard and it hurts and it looks like it could be an infection. And this happened to one of my kids, and I was like, "Whoa, that's big." But what we tell people is you can avoid a tetanus containing vaccine for the next 10 years. That doesn't happen after the first one. It's usually after repeated doses of them. So usually if we see them in babies, it happens like at the doses like after they're a year old. But that's a reason that we delay the tetanus containing vaccines for 10 years in some people. It's not dangerous. It just hurts a lot.
And that is different from the more common redness and swelling at the site. That's very, very common and expected after getting your vaccines.
And what about people who want to space out their vaccines?
I used to get this question all the time. And I think a lot of practices have gone away from allowing patients to space out vaccines. There's so many reasons why it's harder on the baby and harder on the parents and harder on the physician to space out your vaccines. It's harder on the baby because the babies mount a stress response every time they come in and get shots. Every poke, their stress response kind of goes up. But from the stress response from like one poke to another poke, it's kind of plateaus. So if you come in and you get all your shots today and then don't come back for 2 months, you had your stress response and it's gone down. But if you come in this week, get your poke, and then you come in next week for your other shot because you're spacing them out, and next week, which I've had parents want to do this, you're just mounting continual stress responses. And that's the same thing that's happening to the parents.
From 0 shot to 1 shot is a big response. From 1 to 2, it's the same.
Yeah. And then we should come back to also these parents feeling like, oh, but my baby's just getting exposed to so many vaccines. Like as Samantha said, 17. We'll come back to that in a minute too, why it's actually not as many as they used to get before. Like parents like, well, I only had like this many vaccines when I was a kid, but it's actually totally, that line of thinking is not, it's much more nuanced than that. So we'll come back to that. But then, so it's stressful for the baby, it's stressful for the parents. And then for the physician, what happens is now you have these kids that are partially vaccinated in your practice. So when you do have that kid and you get the call that this is a 4-month-old that has a fever, you would, guidelines tell you how to treat babies based on their risk, which is based on their age, and it assumes that they're fully vaccinated. So babies who are under-vaccinated, like if you show up in the emergency room and your baby is unvaccinated or under-vaccinated, we have studies that show that those babies are more likely to get spinal taps, more likely to get blood work, more likely to get x-rays, more likely to get urinary caths, and more likely to get put on antibiotics because we just can't trust that their immune system is at the same level of all the other babies that we know are fully vaccinated. So
I think you're right in saying that the babies are getting kind of repeated exposures to a stressful thing. In my mind, you want to get the doses in of everything as soon as you can, so that the babies are protected and as soon as possible. Because at the younger ages, that's when they have the highest risk of bad outcomes.
Yeah, that's actually probably the most important thing. If you want to prevent meningitis at the age where you might get the meningitis, you want to prevent pertussis when you might get the pertussis. So yes, that is.
Yeah, waiting on your pertussis vaccine till you're 6 months old. Well, you're no longer at risk for the severe outcomes.
You might have mentioned this, but meningitis isn't given to infants, right?
Meningitis vaccine. So there's different, meningitis just means inflammation of the outer layer of the brain. There are many causes of meningitis. The most common bacterial causes are Haemophilus influenza, no longer because of the vaccine, Streptococcus pneumonia, and meningococcal. Meningococcal is the one that has the name of meningitis, like Neisseria meningitis. That one in the United States we give to teenagers. In other countries, it is given to babies. But in the U.S., we give it to teenagers.
But we can give it to children at young ages if they are at higher risk.
Yeah,
because they're traveling to areas, or they're higher risk because they have a condition,
weak immune system,
medical condition that puts them at higher risk too. Let's go back to, oh my gosh, there's 17 shots that we give like at every visit. How is that not overwhelming my baby's immune system?
Yeah, so we give babies we routinely recommend that babies are immunized against 17 bacteria and viruses, so pathogens. And we call the things that we are exposing the babies to stimulate their immune system are called antigens. So as we go about our daily life, when we're born, our immune system needs to get trained. And it gets trained on everything we're exposed to. And the reason we want to train it is so that we can figure out what's the bad thing, what's a bug that we don't want, and what's us. What is me and what should I tolerate and what should I be okay with? Because if you have that balance out of whack, now you start getting allergies and autoimmune diseases. So you actually want to train your immune system on what is myself and what is something else and what should I fight. So from the moment a baby's born and probably before that, they're getting exposed to different antigens. So everything you eat, everything that goes through your intestinal tract, every tiny little cut, every time the tooth pops through and all the bacteria that are in mouths, all those things are training the immune system on what is self and what is something else and what should I be fighting off. So one of the things we do to train our immune system in our society is give immunizations. So those immunizations train the body on what should we fight off in a safe way. So like they have a very low risk of side effects, but the benefit is now I'll be able to fight it off if I'm actually exposed to this pathogen versus getting exposed to the pathogen. Let's see if I survive. If I survive now, I'm immune, but first you have to survive and you might get really sick from it in the meantime. So all those vaccines that we get, we say, oh my gosh, we're giving those babies so many antigens every day. So there are some estimates that have been done. So this is not a baby, but like a kind of average sized male who's an adult every day gets exposed to, has like 30, wait, how many zeros? 30 billion or the next order of magnitude greater cells in their body. Okay.
We don't even know what number.
A very large number.
It could be 300 billion. It could be 3 trillion. We don't know.
But then your body has 39 gajillion bacteria. So you have more bacteria than you have your own cells. So you're exposed to this all the time, right?
So when you're not feeling yourself, you're not hallucinating.
You're just going about your business. You don't know. And your immune system's like, oh, okay, this is me. That's that. This was a bad one. Let's fight it off. And so when we give these babies these antigens, like let's take, for example, the pertussis vaccine. There was an old version of it, and it's actually still given in some countries where they would take the pertussis bacteria and kind of inactivate it, mash it up, and that's what you get immunized with. That number of antigens you're exposed to of pertussis in that case are hundreds, maybe even up to 3,000. I can't remember the exact number, but it's a lot. Now, because that vaccine was actually very reactogenic and a lot of people did get fevers, it worked well, but it was very reactogenic. We now use an acellular pertussis vaccine. So we've chosen, and depending on the vaccine formulation, 2 to 5 of those antigens. So the pertussis vaccine that I got already had more antigens than all of the vaccines that babies get these days, just because of cutting down on that pertussis from a whole cell vaccine to a acellular, what we call it, which has very specific antigens that we give. So our vaccines are very specific. We're trying to just give the antigen that's going to stimulate the immune system to provide antibody and protection against that disease without giving the whole organism. If that makes sense.
Well, that totally makes sense.
That was very well explained. Thanks.
Yeah, and I think that's like, it's such a good thing to remember because, like I said, I was nervous too when my kids were getting their vaccines, even though I know the science and I know the safety, but it does make you nervous. We need to clean up our side effects because every vaccine has kind of different side effects. So we talked about, like, in general, the most common side effects are like soreness, tiredness, more sleepiness, redness and soreness at the site, maybe pain and tenderness at the site. But every vaccine has a slightly different side effect profile. So you definitely want to talk to your doctors, and they usually should give you an information sheet, but it's an overwhelming information sheet. So they should also just tell you what the side effects are going to be. Some vaccines can cause rashes as a side effect. So you want to tell us a little bit about those?
Yeah. So like the measles, mumps, rubella, and the varicella vaccine, they
which is chickenpox, varicella.
My bad, chickenpox, varicella, chickenpox vaccine. They, in a certain percent of people, on the order about 5%, will cause a rash. And the reason is because these particular vaccines are live viruses that we're giving. They're not as they're attenuated, so they're weakened as compared to the kind of natural virus that you can get. But because of that, you get the shot and it does replicate in your body. So for measles, about 5% of kids will get what looks like a kind of measles rash. It's definitely not as severe as natural measles, but that'll happen. And they're like, oh my God, what just happened? Is my kid allergic to it? And it's not. It's what it is the vaccine virus is replicating and it's doing its job and it's creating an immune response in the person who's receiving it. So that's something that we see, and it's not a reason not to get the next one. We see that with the chickenpox rash also. Chickenpox vaccine rash.
So it's creating like a little miniature immune response that teaches your body how to not have an overactive immune response if it's ever exposed to the actual virus.
Exactly.
And if your kid gets that chickenpox vaccine, are those blisters contagious? If your baby develops a rash after the chickenpox vaccine, are those blisters contagious?
No, they're not. They're not contagious, nor is measles. Like, even if you live in a household with somebody who's got a weakened immune system for whatever reason, you should still have the kids get the measles, mumps, rubella, and chickenpox vaccines. Now, you don't want to give those live vaccines to somebody who has a weakened immune system, because then you can have severe outcomes. So that is a contraindication. Having a weak immune system, if somebody has cancer, if they're pregnant, like we talked about before, if they're on higher doses of steroids, do not give live viral vaccines.
Yeah, we don't give live vaccines to anyone with a weak immune system. So like when it comes to rotavirus, for example, sometimes it would depend on if there were immunocompromised people at home, we would sometimes have to get guidance from the doctors of those immunocompromised people, because immunocompromised is also a spectrum. So it would depend on the extent of how immunocompromised they were. And I think for any of these vaccines or medications, for example, also that you get from your doctor, like you have to talk about them specifically for your situation. And we can't speak to everything because there's way too much information out there. So we're just kind of giving like general tidbits and commonly asked questions.
How does a new parent know if their child might be immunocompromised?
So most children, like almost all children, are not immunocompromised. But like, let's say, for the rotavirus vaccine we were just talking about. So let's say there's a family history of somebody in a first degree relative who has this thing called SCID, or severe combined immunodeficiency. That's where you have a severe combined, because it affects the two major branches of your immune system, immunodeficiency. And this is a situation where people it's really life-altering kind of immune deficiency. So if you have a family member with that, you can check the baby before you give them the rotavirus vaccine, because the rotavirus vaccine we give really young. Also, we're not waiting until 12 months like we do with measles. There are also a lot of these immune deficiencies are incorporated in different newborn screening panels. So you can find out from that if your baby might have one of the mutations that is a high risk of a primary immune deficiency.
And about what percentage of infant babies are immunocompromised?
Oh, I don't know it's probably like,
yeah, it's small.
1 per 100,000, 1 per million. It's rare. It's the kind of thing that people are like, oh, my baby, they've been sick so much, they have a weak immune system.
Yeah.
That's not a weak immune system. Yeah.
Yeah. When we're talking immunocompromised here, we're talking about people that are undergoing chemotherapy, who have a known immunodeficiency, who are on immune medications for autoimmune conditions, like
high doses of
inflammatory
steroids
bowel
every day.
disease.
Yeah.
Yeah. So we're talking about people that are being treated for conditions that cause immunocompromise, or they have an immunodeficiency, or they're pregnant, which is an immunodeficient state.
All right. How about we move on to our medical breakdown with two doctors?
So kind of just in general summary, since vaccines have been introduced, and for almost every vaccine this applies, from the tetanus, from pertussis, MMR, measles, mumps, rubella, streptococcus pneumonia, H. flu, different causes of meningitis, introduction of vaccines against these illnesses have resulted in a 90% plus reduction in severe complications due to these illnesses across the board.
That's wild.
Yeah, I think it's kind of one of the miracles that people have been able to do.
And I do think it's just a first world privilege to kind of question the necessity of vaccines.
Yeah, well, as these diseases go away, people don't see them and they don't worry about them because they don't see people walking around with a limp because they had polio.
But they haven't gone away. They've just kind of gone away in the US because
Yeah.
we had been doing a really great job with vaccinating everybody.
Yeah, and one of the things people have worried about is the antigens, and I just kind of want to point out is, back in the 1960s when people got their routine immunizations, there were fewer diseases that they were getting protected against, but they got exposed to over 3,000 antigens through those less purified vaccines. And in the 1980s, that was true too. They had like 3,200 antigens for the kids who were getting immunized back then. But now there are more diseases that are being protected against. And the vaccines have been perfected and tweaked so that kids are only exposed to about 130 some antigens as opposed to those over 3,000 to get protection against more diseases. So it's actually been really great improvements.
Yeah. So while you're getting protected against so many more diseases, so that's why it feels like, oh, we're getting so many more vaccines than they used to give in the 80s, but you're actually getting a lot less you're getting exposed to much fewer antigens. Your immune system is reacting to actually fewer things than it had to react to in the 80s, but you're getting better protection. So it's actually having to do less work for better protection.
Yeah.
I also want to just quickly talk about side effects. Like we talked about some general vaccine side effects like pain at the site, redness, swelling at the site. Babies can sometimes have fevers. Babies can be sleepy more than normal. They can cry more than they normally do. Sometimes there are rare side effects like anaphylaxis we spoke about a little bit, but every vaccine has some rare side effects. I encourage you to talk with your doctors if you're concerned about any of those. But I also just want to mention one I always like to let parents know about with the measles, mumps, rubella, chickenpox vaccine. There is a slightly increased risk of having a febrile seizure with that, which sounds really scary because you're having a seizure and that is just scary when your child has a seizure no matter what. So even though your pediatrician might tell you that it's a benign condition, it's nice to be forewarned about it. And that is very rare, though it happens in a few out of every 10,000 children. But it is something I like to tell parents about too, just to be.
Yeah, and do note that like that can happen anyway. Like kids get sick, kids get fevers, and whenever they have a fever, especially at the younger ages, they can have a seizure. So sometimes when people get a vaccine, they have a fever, and that fever can trigger a seizure in kids who are susceptible to that. And like you said, Angel, with that first dose of the measles, mumps, rubella, chickenpox vaccine, with a combined in a combined form, that you have a little bit of a higher risk of getting a febrile seizure as opposed to getting them separate. But and so some people choose to get them separate for the first dose, but for the second dose of those that they get when they're 4 to 6 years old, we don't see that phenomenon. So usually that'll be combined. Some people choose to get it separate for the first dose, or you can get it combined. But I think it's a good thing to give people kind of a warning about.
Yeah.
All right. This has all been very, very insightful. Angel, you want to take us away to the "Is this normal?" segment?
One of the things that I make sure parents know when babies get shots, especially at the 2 and 4 month mark, is that sometimes babies cry a lot after shots. And babies who don't typically cry a lot might be crying, and that's very disconcerting for parents. And it's, if parents call me and tell me their baby's just been crying since they left the office, I will tell them to try things like cool compresses and, rocking the baby, singing to the baby. And sometimes you have to give some Tylenol, and that's okay too. We do have a Tylenol dosing chart in the show notes, but consult your pediatrician. Your pediatrician should also give you Tylenol dosing. And the other thing I like to tell parents is that sometimes as a part of normal side effects is you could get like a hard knot at the site of the injection. In little babies, usually we're giving injections in the thighs, and sometimes the parents will come back at the 4 month visit, and there's still a little knot there from when the baby had the 2 month shots. That's okay too. That can happen.
All right. And how about we hear some stuff you didn't know?
So Samantha, when you and I were in training, you probably remember that we used to pre-treat babies with Tylenol when they got their vaccines, and that we thought that would keep them from feeling as much pain and discomfort. And it probably did, because we didn't see as much like crying and pain. I certainly didn't get as many calls about babies being uncomfortable after their vaccines. But then someone did a study and looked at babies who were given Tylenol prior to their vaccines and babies who weren't given Tylenol prior to their vaccines. And it turned out that the babies who received Tylenol did not mount as robust an immune response, meaning that Tylenol, in modulating the inflammation and reducing probably the risk of reducing fever, reducing pain, reducing discomfort, just blunted the baby's immune response in general to the vaccines also. So now we don't pre-treat in an attempt to mount a more robust immune response, but we probably get a little bit more pain, irritability, fever, discomfort, crying. And so now some practices don't even recommend Tylenol, even if the baby's like super uncomfortable or has a fever. And then, so I think that's between you and your physician. I usually felt like if the baby's that uncomfortable, go ahead and give the Tylenol, because at that point, then it's like risk benefit again. So you have to have that discussion.
Is it that much blunting that it's clinically significant?
It was enough that it was a practice change.
Huh. Okay.
So, and what I usually tell parents, and I don't know that this has been studied, that, we are letting that immune response mount. And now if you have to give the Tylenol, don't feel bad about it, because we've already versus like you're kind of starting. Yeah, like I wouldn't tell
somebody don't give Tylenol. It's because your immunizations are still going to work. You have like boosters and, multiple doses so that you can get your immune system up and running. Yeah.
Yeah, you don't need to stress yourself or your baby out that much. But it was a
change in
common practice to pre-treat with Tylenol. And then Samantha, thank you so much for being here with us today. Again, giving up so much of your time. This has been so fun to catch up with you a little bit. It's so different than when we would just go out to dinner, watch Sex in the City. Remember we used to watch Sex in the City every Sunday night?
Yeah. I can't believe that now we're talking about Roman having a baby. This is really awesome.
I know.
Oh, I can't believe it either.
I know. We have teenagers. I mean, my daughter wants to watch Sex in the City, and I'm like, what? And Roman's having a baby. Like, what is happening?
And her daughter also wants to be an auntie to my son. She's like, yeah, I'll be more of an aunt figure than a big sister.
I mean, kind of, huh?
Yeah, I guess so.
Wow.
Yeah, I was like, yeah, isn't she an aunt? And then I was like, oh, no, she's a cousin. Yeah,
she's a cousin. That's fun.
All right. Well, we hope that you'll join us again.
Oh, thanks for having me. It's so fun to see you guys. Sure. Yeah. Thank you, guys. It's really nice to see you.
Thanks for joining us today as we all learned a little bit more about vaccines. If you think you learned something new, something that might be helpful to other parents, or you just had some fun listening, please share, rate, and review. It really helps other listeners and viewers find content that is accurate and science-backed and given with good intention.